What are we giving them that are affecting their level of consciousness? What category of drug? I'm looking at Deanna because she's already said it before. Just a category. Central nervous system depressant. A lot of these drugs are going to depress the central nervous system. In the perioperative area, we give a lot of drugs. We give them before they go to the OR. We give them in the OR. We give them when they get out of the OR. So in the perioperative, that means all those areas, they get medications that decrease their central nervous system, therefore decreasing their awareness, level of consciousness. Safety is an issue. And you guys know already the implications of safety and what you would do for nursing interventions based on safety. What neurotransmitter relates to a neuromuscular disorder like myasthenia gravis? Beautiful, acetylcholine. And yes, when we do a basic one, we jump into myasthenia gravis and we talk about that disease process. Okay, when we talk respiratory. Talk to me about succinylcholine.
It causes malignant hypothermia.
What does it do?
It causes malignant hypothermia.
It
can trigger.
It can trigger it. Malignant hyperthermia is very, very rare, but very, very serious. Succinylcholine can definitely trigger a patient who is susceptible to malignant hyperthermia. How would we know that? History. Okay, there's no test, there's no blood work. They can do what's called like a muscle biopsy. They're not gonna do that on everybody. It's usually based off of history. And succinylcholine, talk to me more about that drug. Can you look this drug up?
It relaxes the skeletal muscles.
Yup, almost paralyzes them. But what's the interaction? Who shouldn't get this drug? Yes, somebody who has malignant hyperthermia. We've established that. Who else? Yeah.
Neuroangle glaucoma.
Yes, yeah. So a lot of times, to be honest with you, I'll look at medications. And if a patient is on a drug like Timolol and their eye drops, right away, I will ask the patient, oh, you take Timolol. They're like, oh, I have glaucoma, you know? Or they'll say, I take it for the pressure in my eye. They may not know it's glaucoma. They might know it's pressure in the eye. If I'm in the perioperative area, I start this and I make sure anesthesia knows that they have glaucoma. They're on Timolol. They're on a medication for glaucoma. What happens to when you stimulate the sympathetic nervous system? What does it do to blood pressure, and what does it do to bowel cells? When you stimulate the sympathetic nervous system, what does it do to blood pressure? And what does it do to bowel cells? Yes. No, that's anticholinergic. Okay. You guys have to know sympathetic, parasympathetic. Sympathetic, if you know sympathetic, and you know all the responses, then you know parasympathetic. They're just the opposite. Remember the person in the alley, and you're scared. Think about everything that's happening in that alley. The blood pressure goes up, heart rate goes up, the pupils dilate, so I can recognize you in a lineup, okay? And because I'm so scared, immediately my muscles, I get scared straight and I can't move. But then I can move very quickly because my bronchioles open up, I get air in there. My liver increases, so increased glucose metabolism occurs because glucose is a fast form of
Energy.
Energy, so I can
Right.
run out of there. And I don't pee and I don't shit. Okay? Because that would hamper my running out of the alley. I make it sort of funny so you can actually visualize all the things that you're gonna be tested on. And when you understand that sympathetic response, when we talk about drugs that have a sympathetic response, then you understand, oh, now I understand why glaucoma meds, somebody with glaucoma is gonna have a problem. Somebody who's on anticholinergics are gonna have a problem. Do you see how things come together when you understand just the basics of sympathetic and parasympathetic? Okay. Did you guys look up the term, piloerection? And what'd you come up with?
Goosebumps.
Okay, good. I just thought that was really funny. Would you look up for nicotinic receptors? What are nicotinic receptors?
The dopamine? I remember the question you got on the test, because I got it wrong.
Uh-oh.
Something about stress.
The most anxious patient in surgery has a response of nicotine.
If you're giving a drug that stimulates those receptors, the nicotinic receptors, what are you gonna see? What are the effects?
Anxiety.
What does it cause?
Stress reaction.
Okay. You said it.
Anxiety.
You said it before. Contraction. You're right. Yeah. Muscle, did you say muscle contraction?
Huh?
Oh geez, okay.
You got it.
I thought it, okay.
In my
Guys,
head.
look up nicotinic receptors and how they work with the muscles. Isopreternal. What does isopreternal do? Guys, this is
Treatment of shock.
okay, and what does shock mean? What does that mean? Okay.
Systemic.
No, you're going, okay. She's talking cardiogenic shock. Now you're going to respiratory. Let's stay with
Okay.
shock. What happens in shock? She said decreased cardiac output. How would I know that? Am I measuring cardiac output indirectly? Unless I have an internal device to measure cardiac output, I can't measure cardiac output directly. Indirectly, I measure cardiac output by what? In blood pressure. Blood pressure. I feel like you guys are falling off here right now. So we're at like number 50.
Wait,
Huh?
rewind. I'm not understanding
What didn't you understand? Cardiac output?
this. Yeah. And that's
So-
it? It just affects.
She said isopreternal, the drug isopreternal is used for shock. Not enough just to say shock, what is shock? She said decreased cardiac output. Then I said, well, decreased cardiac output, can you monitor that directly? Well, you can if you have a monitoring, an invasive monitor, Swan-Ganz catheter, that you might not even know about right now. But indirectly, cardiac output is measured by heart rate times stroke volume equals cardiac output. That's the equation. So I can look at the heart rate, but more specifically, blood pressure tells me what the cardiac output is like. So blood pressure. Okay. Okay, a drug. So if somebody's in shock and they have a low blood pressure, low cardiac output is assumed, what medication would you give? Okay, what else? Low blood pressure.
Would epinephrine help?
So something that.
Digoxin? No,
Oh.
not digoxin.
Something to like restart your.
Low blood pressure,
Atropine.
that's atropine, no, atropine's gonna increase the heart rate. Sympathomimetic, you can give a sympathomimetic, but what about a vasoconstrictor like dopamine, dobutamine? Remember those? Not really? Okay, let's, look up dopamine and dobutamine. These meds are usually given for shock. But dopamine can cause an adverse effect. I'll be with you guys in just a little bit.
I have something to put in your office.
Oh, okay, here.
Sorry, guys. Good luck on your finals.
Thanks.
Dopamine therapy. Okay, what's dopamine? You start a patient on dopamine. Deanna said, patient has decreased cardiac output. Noelle says, yeah, I can tell by the blood pressure. We start them on dopamine, which is a vasoconstrictor. It's going to squeeze the vessels. By squeezing the vessels, we get an improved blood pressure. But what is an adverse effect of dopamine?
Too high blood pressure.
Well, it could be a too high of a blood pressure. That's why we titrate. We know the term titrate, right?
Yes.
But it can increase the heart rate. By increasing the heart rate, sometimes patients can have
Palpitations.
dysrhythmias.
Dysrhythmia.
Dysrhythmia. Adrenergic blocking agents. Adrenergic blocking agents. Talk to me about that.
Contraindicated with diabetics.
Okay, contraindicated with diabetics. But if you give an adrenergic blocking agent, what does it do to norepinephrine? What do you think?
So they inhibit the sympathetic nervous system.
Decreases.
So the neurotransmitters, the sympathetic neurotransmitters are epi and norepi, right? If you're blocking those, you're blocking norepinephrine or epinephrine. An adrenergic blocking, the term adrenergic, sympathetic adrenergic, you're blocking epi and norepi, right? Think about that for a minute. Adrenergic blocking agents prevent norepinephrine from being released from the adrenals. An adrenergic blocking agent, what assessment would be a priority? Somebody taking an adrenergic blocking agent, what would be a priority nursing assessment? You're talking cardiac.
Well, I was thinking like depression of the lungs and stuff, and then I was gonna go to the heart.
Adrenergic affects more of the blood pressure and the heart rate. So when we're given a med, like an adrenergic blocking, heart rate would be one of them. So if it's going to block that, bradycardia is something we really would want to assess for. Gotta think of these drugs. What is it gonna affect the most? Now, you're not wrong in thinking that how does it affect the bronchioles? Giving a drug like that could cause bronchoconstriction. Not a med you'd give to somebody who has maybe asthma or some type of reactive airways. Okay, what is bethanol used for? Bethanol.
Urinary retention.
Okay, beautiful. So what are we gonna monitor for?
Input output.
Ionos, making sure the bladder function is improved. Again, therapeutic effect. It's not enough just to give a drug. Why are we giving it? If you're giving a drug like an anticholinergic, what would be a therapeutic response? So drugs that block the effect of acetylcholine are anticholinergic. What's an adverse effect of it?
Low blood pressure.
Okay, if you have a low blood pressure, what does your heart rate do? Yes, good, because it's called a compensatory mechanism. So if something lowers the blood pressure, the body needs to maintain its cardiac output. So if blood pressure gets lowered, heart rate
Increases.
goes up. Okay, talk to me about scopolamine patch. What do you know about a scopolamine patch?
This is the one you have it on for 3 days.
Yeah. What's it
I've had it
for?
for nausea. People get it when they go on like boats.
Mm.
Okay.
You know you get it in surgery too? Why would someone put a patch on you for surgery?
So you don't aspirate.
So you don't have problems with nausea and vomiting. Same thing. It's the same thing. You're right, it lasts for 3 days. The reason I mentioned the 3 days is because so many nurses are quick to take them off after surgery. Like, say somebody has surgery and they spend the night. When we discharge the patient in the morning, we wanna take that patch off, it's usually behind the ear. But if we know it lasts for 3 days, why would we do that? We wouldn't. So knowing how long it lasts is important. Otherwise, you're taking it off, now they're going home, and what's gonna happen?
Bleh.
They're gonna have problems with nausea and vomiting. What's the hypothalamus do?
Monitors the body's homeostasis.
Okay, beautiful. It's sort of that coordinating center for the body. And it does, it tries to maintain homeostasis. I asked you to look up Leuprolide. Did you look it up? Leuprolide treats prostatic cancer. But what are some of the adverse effects?
Mood changes.
Men will grow breast.
Gynecomastia,
Gynecomastia.
also edema. Patients can experience edema as well. They get urinary frequency from it, not urinary retention. So they get urinary frequency, don't get fooled by that. They'll get urinary frequency, not urinary retention. A peripheral edema, you'll notice, how do you assess for peripheral edema? Look at their skin, right? That's how you assess for peripheral. Where are you assessing for peripheral edema? On the extremities. Okay. Somatropin. What is somatropin?
To help people with their growth.
Yeah. Who primarily? Children. But what do we need to assess for? For giving it, what's?
With the epithelial plates.
Yeah, the plates. Because if they've already come together, usually it means
They stop growing.
they stop growing, it's not gonna be effective. A patient is getting glucocorticoids. What would be, a priority nursing diagnosis with a glucocorticoid? What do you know about a glucocorticoid? What's a glucocorticoid do?
It's a steroid.
It's a steroid, what does it do?
It interrupts the hypothalamic pituitary axis.
Okay, and therefore, what does it do?
You raise blood sugar levels.
It can do that.
It's
Okay,
anti-inflammatory.
immune system, bingo. So if it lowers the immune system, what is the person at risk for? Infection, yeah, immunosuppression. That's what happens, good. Do you know what TSH does? So it stimulates the thyroid gland, right? Simple as that, it stimulates the thyroid gland. Thyroid hormone production and release are regulated by the anterior pituitary hormones called TSH, thyroid stimulating hormone. Regulated by thyroid tropin releasing hormone. That's that negative feedback loop, right? You guys remember negative feedback?
Yes.
Patient is on an anticoagulant. What should you be monitoring for? Bleeding, bleeding, bleeding. Does physical exercise, going to the gym, interfere with type 1 diabetes? Okay. What are the signs of hypoglycemia? Hypo. Dizziness, tachycardia,
Shallow respirations.
okay. What's the skin like?
Clammy.
Cool, clammy, diaphoresis sometimes? All right, got to know the signs of hypo and hyper. Usually flushing of the face, that redness, that fruity breath. This is all signs of hyper, having to go to the bathroom. Polyuria, polytipsia, polyphagia, the 3 P's are related to hyper. So please know the difference between hypo and hyper. Pramlintide. What do we know about pramlintide?
This is a drug that causes extreme addiction.
Pramlintide? Absolutely not. It helps gastric emptying. Pramlintide, it helps gastric emptying after a meal. So timing of the meal is really important with this drug. It has a very, very rapid onset, but the timing of when you give it is really important. Hemoglobin A1C, what do you know about it?
3 months worth of glucose readings.
Okay, is it better than a blood sugar?
Yes.
A female patient is being treated with methyl testosterone. What would be a complication from a woman getting methyl testosterone?
Deeper voice.
Yeah, but is that really serious?
Erasure.
Is it really serious?
It can be. I'd be upset.
You'd be more upset if you got liver cancer.
You're right.
Okay, so when you're answering a question, you're not wrong, but you have to know what's more serious. I can live with a little hairy suit. I can't live with liver cancer. A male patient taking androgens, how do most of these drugs, if a male patient needs androgens, but is having difficulty swallowing, what drug could we give him? He needs androgens. Can't give him anything PO because he has difficulty swallowing. So what drug would you expect to give him? Testosterone, people, look up testosterone. We can actually put in testosterone, long acting, so that a patient wouldn't have to take PO testosterone. They could get an injection, they could get pellets. You know the pacemaker cells of the heart? Okay, you know the conduction of the heart, SA to the AD, right, to the right and left bundle branches, the Purkinje fibers, gotta know the conduction. Why does pulmonary edema occur? What sided heart failure is pulmonary edema? Left. What patients are at highest risk for developing, what ethnic group is the highest risk for developing hypertension? African Americans. What drug do we normally start people who have hypertension? What do we start them on? Yeah, diuretics. But that's only if their blood pressure is slightly elevated, like I said. But that usually is a first line. What antihypertensive should you not give if somebody has impaired renal function?
Can you say that again?
What antihypertensive should you not give if somebody has impaired renal function?
Diuretic.
That's not an antihypertensive, that's a diuretic.
Maybe the Digoxin?
Hmm? No, not digoxin. I mean, you'd still monitor.
What is it, potassium?
The ACEs, the Prills. Okay, the Prills. We give the Prills to control hypertension, but we have to be monitoring their renal status. So how do we monitor renal status?
Look for BUN and creatine? Creatine?
Creatinine. Yeah,
Creatinine.
creatinine. Big difference between creatine and creatinine. BUN creatinine, and also, what else? What else could we monitor that I said about 2 hours ago when I started this? That I said decline in people, older people.
Oh, the glomerular filtration.
Creatinine clearance. Glomerular filtration rate, creatinine clearance declines when somebody has renal disease. We generally just talk about BUN and creatinine, but if somebody has a decreasing GFR or creatinine clearance, same thing, means they're having a problem with kidney function. What are some adverse effects of diltiazem? First, what is diltiazem?
TCB.
TCB?
Sorry, calcium channel blocker.
Calcium channel blocker. What are some adverse effects specifically to this drug?
Low heart rate,
Bradycardia, low heart rate, yes, and
hypotension,
hypotension, and one more,
peripheral edema.
peripheral edema. Beautiful, beautiful. Somebody working on roofs in the state of Florida in the middle of summer, taking an ACE inhibitor. What's the issue?
It's either not sweating or sweating too much.
Yeah, sweating too much. Up on the roof, they're gonna be sweating. They're gonna be dehydrated. And if they're taking a medication that's gonna drop blood pressure, and I've always said volume equals pressure, so they're gonna get a double whammy here, right? Okay. Always knowing the patient's last menstrual period is very important assessment and data to record, because a lot of these drugs, like you told me, can be teratogenic, harm to the fetus. So knowing somebody's last menstrual period, very important to assess that. You told me the difference between right and left-sided heart failure. Left-sided heart failure is gonna back up into the lungs, causes pulmonary edema. When we have the right side of the heart failing, it backs up to the rest of the body. This is where you see a lot of hepatomegaly, which enlarged liver. You see a lot of edema. You see a lot of jugular vein distension. Do you guys know what orthostatic hypotension is? Okay. What do we do when we suspect it? What type of pressures do we do?
Laying down, sitting, and then standing.
Okay, what's that called?
Orthostatic.
Yep, orthostatic blood pressures. What affects it is that positional change, going from whether it's sitting, standing, lying. What do you know about digoxin?
I use for a stronger heart contraction.
Yep, yep, so it's a positive inotropic drug. What do we have to monitor for though?
The blood digoxin level.
Digoxin levels. It can be very hard on the kidneys. Yeah. So we have to assess kidney. What's the antidote for DIG?
Vitamin K.
No.
Ooh.
Digoxin immune cells.
Yep. When you're giving an anti-arrhythmic, patient should be on the heart monitor, and we're monitoring the rate and the rhythm. Giving drugs such as nitrates, and calcium channel blockers are gonna cause a severe drop-in. Blood pressure. All right, you better know atorvastatin. What type of drug is it? Category. When, what drug should you use grapefruit juice with?
That's where it's at.
The
Atorvastatin.
The antidote for heparin.
Sulfate.
Beautiful. What's the problem with anticoagulant in GI ulcers?
Increased chance of bleeding.
Bleeding. What should we take iron with? Food, but not dairy, milk, no dairy, eggs.
Grapefruit juice.
Huh?
You can take it with.
But you can take it with grapefruit juice. Actually, it's best to take it with grapefruit juice because it's a citrus food. For a change. B12, why can't B12 be taken orally? Look that up, B12, why can't it be taken orally?
Is it because it doesn't metabolize?
Yeah, if you're giving it for pernicious anemia, they have an inability to absorb B12 because they don't have the intrinsic factor. People taking diuretics at home, what safety things do we need to promote with them?
Better monitor that weight.
Monitor the weight, for sure. And also, the same things at the hospital, you gotta make sure their home is safe if they're taking these medications. Do you wanna take a diuretic in the day or at night? During the day, because otherwise, yes. All right, I'm a little bit, I gotta start an exam. I'm a little bit shy, so make sure you focus. You guys did really well with the first 50, and I can tell you haven't studied the second 50. So please start there, okay?
Thank you.
You're welcome. Did everybody sign in?
Yes.